There can be lots of reasons for people to have pain around the elbow, but largely they are either soft tissue related or bone and joint related. If they are soft tissue related, they tend to be more superficial pains, whereas if they are joint related pains, they tend to be more deep-seated pains. The common causes of elbow pain, if you look at it from a soft tissue perspective, tends to be the tendon-related pains, which we often see over the outer part of the elbow and the inner part of the elbow, and they're commonly referred to as tennis elbow and golfer's elbow. And these are different to the joint-related pains, which are often deep-seated and normally come in combination with some mechanical symptoms where the joint is stiff and more restricted in terms of range of motion. Whereas with the soft tissue related ones, they tend to be pain that is brought on with activity, but the joint movement is preserved. The treatment option very much depends on the pathology. So if we are dealing with soft tissue related problems, we know the natural history of these conditions is that most get better over time, and that's why often we approach it very conservatively. Surgery is very rarely indicated, but if it is indicated, depending on the pathology itself, can be anything from arthroscopic techniques to open procedures. So elbow surgery, like any other surgery, carries risks. These can be general risks which are associated with any operation, and more specific risks in association with that procedure. The risks are low. These are fairly safe procedures, but the risk of infection, risk of incomplete resolution of symptoms, the risk of neurovascular injury are all small risks that we mention with these specific types of procedures. But I would say the other concern is always that you can never guarantee 100% outcome with any of these procedures. So the benefit to the patient is really to deal with symptoms that have been clearly present at that point for some time and have not responded to first-line treatments. In that situation, the surgery can be very effective at increasing the range of motion or dealing with mechanical symptoms such as locking when these have been present for some time, and also when there is soft tissue related problems such as tennis elbow and golfer's elbow, which have not responded to the first line treatment, including activity modification, anti-inflammatories, physiotherapy and injections. In those situations can be a good long-term solution to the problem. The recovery period varies hugely on the type of procedure performed, but in general, with most elbow surgeries where you're either removing loose bodies or you are releasing a joint or you're dealing with tendinous problems such as tennis elbow and golfer's elbow, the emphasis is on early movement, so early mobilization is encouraged, but most people need use of a sling for a short period of time. But we normally explain to patients that most recovery to a decent level takes place in the first 6 weeks, but it can take up to 3 months to make a full recovery before resuming more physical activities.